People can get cut and sewn anywhere, but what people really need is the proper direction in what they want and figure out what their endpoint goals are. And then to be properly managed in the operating room, but even more importantly, once you're awake and you need your emotional support. People need emotional support. From my perspective, I have the idea that I'm going to meet you, talk to you about your concerns, maybe expand a little bit to make sure that there's not some adjacent things that need to be dealt with.
I steward them through the process of proceeding with surgery. I basically become their cheerleader because it's a big decision for them and it's life-changing for them, but I want them to know that I am there for them, and if they need me to go into surgery, so be it. I'll be right there with them as they fall asleep and be there when they wake up.
A person that says, I'm looking tired, well, I explore whether they might have thyroid problems, or whether they're working too hard, or whether there are other stresses in their life that says, is surgery a good idea for you? And approach it in a three-dimensional way.
People need to know that they're loved and that they're supported, and that goes back to being an advocate, being their cheerleader for them. I want them to know that they're going to have good days, they're going to have bad days, but at the end of the surgery, they're going to love the practice and they're going to be very, very pleased with their result.
As a board-certified plastic surgeon, I'm very comfortable where the muscles are. I've been there, as they say. I know where they are surgically and non-surgically. Certainly there's an artistic flair to that, and I am very blessed to have that nature to say I can manage to keep the aesthetics and the scientifics in harmony with each other, because that's what they are, a blend of science and art. That's the sine qua non of plastic surgery in my mind. It's a great deal of value to me that all of us in my office create an environment of harmony, an environment of nurturing and support, because people are vulnerable when they're recovering from surgery. And sometimes, even if we meet them before surgery, they're still not at their best for a while. So they need to know that they're going to be supported. But we're going to really be present for them, including me. I call people at night. I make sure they're in touch with me. I say to the spouses or boyfriends or to the husbands, whomever, whoever the significant other, if you have any problems, I want you to call me. Here's my cell phone number. I don't want you to solve problems on your own or concerns. And my whole staff takes that approach. We're available, and the way to do that is to have a nature that comes to this practice.